Hi, your pet has been diagnosed with allergies and is going to be getting a custom-made allergy vaccine. So when you leave here today, you are going to go home with some items. You're going to go home with a tray of syringes. They're 25 in here, and when you need more, you can get them through our office. You're also going to go home with the allergy vaccines, or in some cases they may be shipped to you because there is some time involved in preparing them. So you're going to get 3 of them. One is going to be labeled number 1, another is going to be labeled number 2, and the large one's going to be labeled number 3. And the difference is number 1 is the most dilute, number 2 is less dilute, and number 3 is the most concentrated. So this is going to be the maintenance vial. You will also get a folder that has all of the handouts that you will need in order to administer the vaccine. So you will also get these stickers. If you use a paper calendar, you can put them on your calendar to remind you when to give the vaccine. So you are going to be needing a syringe. These are 1 ml syringes, and you can see the marks: 0.2, 0.3, 0.4, 0.5. And what we're going to do is when you administer the vaccine, you start with the lowest volume and you gradually work your way up. Now, the way that you determine how much you're going to give on any given day is going to be on this schedule for injectable vaccine administration. And as you can see, it will tell you vial 1. The first day you give 0.1 cc's. cc is just another name for an ml. You're going to give 0.2 cc's the next day, and all the way up until you're giving a full cc. Then, the next time you're going to administer the vaccine, you're going to start with the second vial, vial number 2, and you're going to repeat that process starting with the smallest volume and gradually increasing up to the largest volume. And finally, you're going to go to vial number 3, which is the maintenance vial, starting with 0.1 and then gradually going up to a full cc. Now, if you look at this form, you'll see that initially, if you look at the days, you're giving injections every other day. So day 1, day 3, day 5, etc. Now, you may go to 25 days or 29 days. It will depend what Dr. Jeffers recommends, but at that point, then you switch to giving the injection after a week, and then you switch to giving the injection after 2 weeks. And most animals then will stabilize being given the vaccine every 2 weeks, although Dr. Jeffers may adjust it. Now, do remember, it takes at least 4 to 6 months until you see an improvement with this technique, and it may take up to a year for you to see the full improvement. So let's go over how you will prepare the syringe to give it to your dog. So what you're going to do is you're going to take the cap off of the syringe. You're going to take the vial, and just for the purposes of this demonstration, I'm going to use vial number 1. You invert the vial, hold it in your hand, and then you're going to push the needle up through into the fluid. Now, what you're going to do is you're going to draw back. So initially, you're going to start with the 0.1. So you always want to draw more than what you'll need. So I'm going to draw back, and it really doesn't matter. I'm going to draw it back to about 0.4. And now what I want to do is get rid of any air bubbles. So I'm going to flick it with my finger. And there weren't really very many air bubbles there to begin with. There's a little one there. And so what we're going to do is push up, and we'll look in at those hash marks, and you're going to push all the way up until you have the desired amount. And you do need to know, you see this little black end of the plunger there, you want the top part to be in line with the hash mark that indicates the appropriate volume. So right now we're going to be giving the 0.1. Now let's say if we wanted to give 0.2, it would be there. 0.4 would be there. So when you have the desired amount, you're going to pull it out, and then you would call your dog to you. I am not going to give our subject the vaccine today because he already had his for this particular time frame. So I'm going to call my subject to me, a little crybaby. Obi, come here, puppy. Hi, hello there. Sit. So when you give this injection, it's going to be a subcutaneous injection, which means that you're going to give it, you're going to pick up the skin and you're give it under the skin. So we like to give it around the head and the shoulder area. You want to stay away from midline. So you can go over on either one side or the other. And it's a good idea to alternate the sites. So if you give it on the left side one day, you can give it on the right side the next day. So it's a good idea to jot down on your records where you gave it. So I'm going to take this syringe, and before I get ready to give it, I want to position my hand. So I like to hold it between my first and my second fingers and have my thumb ready to go. And then you're going to be picking up the skin, going in at about a 45-degree angle. You don't want to inject it into the body. You want to inject it into the tent under the skin, and then you push it in. So again, and you'll see another video where we teach you how to give it to your dog so your dog's not scared. But again, lifting up the skin and injecting at about a 45-degree angle and pushing it in. Okay, you're all done. All right, and now you can go on to the next video that indicates exactly how you give it to your dog so your dog's not scared.